Thank you for the introduction, Stacy. I'm going to talk about toilet training with kids on the spectrum. Just before we start, can you, with a show of hands, tell me how many of you are parents or caregivers? Okay, great. And how many are Kennedy employees? Great. And just professionals in the field? None. Okay. Awesome. Before I start my presentation, there's a couple things that I want you to know. There was some miscommunication about the topic and the content of my presentation. I'm just primarily talking about challenges that are associated with kids on the spectrum and potty training them. My presentation will not include enuresis and encopresis. And also, I'm also going to talk about some strategies that we'll use when we're teaching toilet training for kids on the spectrum. Now, why is toilet training so important? Toilet training is really important because it is a milestone of independence. Just like learning to feed oneself, feed themselves or dress themselves, toilet training is also an important developmental milestone. A child who's potty trained has many more opportunities for socializations. More sitters are available. Sometimes schools demand that you're toilet trained. Kids can have more play dates. For older kids, it increases opportunities for placements. Apart from that, there are also hygiene concerns. So if they're toilet trained, they're less likely to have skin irritations of the genitals. So there's very good reasons for toilet training. Another reason a lot of parents will come and tell me is that they want their child to be potty trained because it's very expensive. It's just cheaper in terms of paying money for diapers, pull-ups, and everything that goes with it. That's why toilet training is important. However, just to give you some perspective, kids on the spectrum take longer to get toilet trained. Some figures, according to this figure, kids on the spectrum take almost 2 years to be potty trained, fully potty trained, whereas typically developing peers might be trained in 5 or 6 months. So this can be a long and challenging process. However, keep in mind that this figure includes all the kids with autism. So high functioning, low functioning, it's just an average figure. It could be longer or shorter. Now, why is toilet training kids with autism so much harder? And there's many reasons for it. Part of it is if you look at features of autism, communication difficulties, social difficulties, restricted patterns of interest, all those interfere in the whole toileting process. So kids on the spectrum might not be motivated to be a big boy or a big girl and be potty trained. They might not care so much about making their parents happy. A lot of kids get toilet trained because they realize there's social consequences to that. They're more averse to having accidents, and that effect might be lost on kids with autism. Some kids might not be able to understand instructions. They might not be able to communicate when they need to go to the toilet. So those definitely interfere. Some sensory sensitivities, such as being averse to the sound of flushing. Sometimes bathroom smells, kids can be more averse to them. So those sometimes interfere in toilet training. A lot of our kids also have motor difficulties, either gross or fine. So sometimes, using zips or buttons or fasteners, those can interfere in the whole process. Sometimes they might not be able to be balanced, and so sitting on the toilet could be a challenge. Behavior problems can add an additional layer of challenge because if they're acting out, that might be harder to toilet train them. Also, because they're so used to routines, they're so resistant, sometimes they can be very resistant to change. So trying something absolutely different is harder. So peeing in a pull-up is a time-honored tradition. And now you want me to pee in this cold, white ceramic bowl? That is really, really hard. So anything new, anything out of the routine, that can be a challenge. So that's why this process takes longer. Now, took a look at the literature to see what are some readiness skills. Our society has this idea that a child should be cognitively or physically ready for toilet training. And if you look at the literature, there's a ton of signs that they say a child should have before toilet training. But we would love to have these, but if we really went by these, very few of our kids would be toilet trained. So it has things like interest in toileting. So interest means, watching their siblings in the process, or asking questions about the toileting process. If a child is only interested in Thomas the Trains, he's not going to be interested in his siblings using the toilet. So that is, it's not really going to happen. Asking to use a toilet. If we wait for the child to ask for the toilet, then we are going to take forever to achieve toilet training. So all of these would be great. We would love to have them, but we don't really, in our clinic, we wouldn't wait for these signs before we start toilet training. So what are our prerequisite skills? The first one is we want to make sure they have a clear urine stream. So that means that they can hold the urine for some time. So if it's constantly dribbling and there are no short periods of time, which is like about an hour or two, where there's a dry diaper or dye pull-up, we would say that they're not ready. If it's dry for an hour, yeah. If you have periods of an hour or 2 hours where it's dry, then you would say they're ready. If it's never dry, if they're constantly needing to be changed or they're constantly dribbling, then they might not be physiologically ready. Now, another prerequisite we say is the ability to sit on the toilet for at least 3 minutes. And if that's not achieved, then that's where we would start. We wouldn't wait for it to happen naturally, we would work on that. But that's what we would focus on, not necessarily toilet training. First, just sitting on the toilet for 3 minutes, and I'll talk a little bit about how we do that. Boys, we always have boys sit on the toilet. Now the question arises, do you make them stand or sit? Until a child is completely independent in using the toilet for urine, we have them still sit, because what happens is while they're sitting for urine, there might be an accidental bowel movement, and I don't want to miss the opportunity to praise that or catch that. So because there are those accidental bowel movements, until they're completely independent, we have boys always sitting. And also before you start, you want to decide whether you're going to use the potty or a toilet. There are advantages, pros and cons for both. So if it's a potty, you can take it places, it's easier to move around, and it's comforting. The child doesn't have to worry about balance, they're more comfortably seated on it. But the challenge with that is you have to transition them again to using a toilet. So even though toilet might be harder, you don't have to deal with the transition. So it's kind of like you weigh your options. So let's talk about sitting. If they are not able to sit for 3 minutes, we start really, really small. So if we start where the child is. If the child is able to sit only for 10 seconds, that's what we're going to start with. So you use a timer and say, it's time to go to the bathroom. It could be any brief, neutral statement, time to go to the bathroom. You set the timer, seat them on the toilet, set the timer. When the timer gets off, then they can get off. But if they try to get up before the timer gets up, then you either block them or put them back on the seated position and say you can get up when the timer rings, and then and after that they earn a reward. So you gradually would shape that up. So once they're consistently able to sit for 10 seconds, it doesn't have to be 10 seconds, it depends on wherever the child is, but you would increase it to say 20 seconds or 30 seconds. And ideally, when you're shaping the sitting for a longer duration, ideally we would use a timer that, if you're using a timer for timeouts, then ideally you would use a different timer. It doesn't have to be a visual timer. You could use a visual timer if the digital timer doesn't make very much sense to the kids, although they don't really have to. All they need is to hear the sound. But like a visual timer where there's a red dial like in this picture, and the dial decreases as time passes, and the child knows when it's time to get off. And here again, the important part is the focus is only on sitting, not for them to use the toilet, not for them to urinating in the toilet. However, if they do, then that has to be definitely rewarded. That has to be caught. And so you want to always be ready with your rewards. And then I'm going to talk a little bit about what we call intensive toilet training. It is intensive because it really takes a lot of effort. It really means that it is a priority to you. It's based on Fox and Aswin studies from the 1970s, which are some of the seminal studies on toilet training. But when we say it's intensive, it means you're absolutely ready in terms of time to commit to toilet training, and you are ready to eat, breathe, and sleep toilet training. So what you want to do is kind of block. Ideally, you would block a few days where your goal is only toilet training. You're just watching the child or interacting with the child and engaging in activities with the child. And usually, ideally, you would have it around, summer breaks, winter breaks, long weekends, somewhere where you have a block of 3 or 4 days where you can focus only on toilet training. Now, it is ideal, but it's not imperative. If you don't have, if the next break is 4 months away, you don't have to wait for that. I would still start it. And what do we do with intensive toilet training? Full-time underwear. During this period, the child has to absolutely must wear underwear. This is really hard initially, and caregivers usually don't want this because there are accidents. It's messy. It is not fun. However, we really think it's important because we are teaching the child a new sensory cue. Earlier, they were used to peeing or voiding in a pull-up or a diaper. So that was their cue to void. Now we want to have a new sensation that is of the underwear as a cue to void. If we don't do that, it might be too confusing. Well, I could pee in the pull-up earlier and now I can't. It's like saying, well, you can drive when it's a green light, but now you can't. You have to stop. That's going to be a problem. So that's why it's really important to have only underwears during this time. Now, there are some exceptions. During nighttime, they'll wear pull-ups, and also for public places or initial days of school, because you don't have the opportunity to, might not have the opportunity to reward or do what we're going to talk about. During this period, we also want to have them wear easy clothing that you can remove easily, usually sweatpants, something, or things with just elastic and not buttons or zips, so that doesn't get in the way. Now, when I say intensive toilet training, and I said block off a few days, those 3 or 4 days I want to mention is only to jumpstart the process. That doesn't mean that we're going to achieve toilet training in 3 or 4 days. We don't know how long it's going to take, but that is just to kind of jumpstart the whole process. Now, communication is also important, and we want to find a way that the child understands our directions and also can communicate, have a way for them. We want to take into account their communication ability. So we want to make sure that our instructions are very short, very direct, very brief. If they're verbal, then we want to decide on the specific word for a bathroom, for instance, or very specific words that we are going to use consistently. Now, the question arises, should I use words like potty, pee-pee, or more grown-up words like bathroom? And ideally, we say use something that they can use even once they're older, because they get used to it, and it might be harder to unlearn and learn a new word. So things like pee-pee might be appropriate when they're in preschool, but once they're older, we don't want a 15-year-old saying that I need to go pee-pee. If they are not able to communicate verbally, we want to determine what's an appropriate way, either sign or a PEX or some kind of picture symbol, so that we prompt them to go to the bathroom. And we want to prompt them when it's time to go to the bathroom and when we are about to have them sit on the toilet. And I'll talk a little bit more as we go along. Another thing that might be helpful is to have some form of visual supports. a good way to do this is to do a task analysis of the whole toileting routine. So this would help them learn the whole routine. A task analysis is to break down a whole sequence of tasks and put them either in pictures, lay them out in pictures and words. This is also helpful because you can consistently follow the same routine and the kids can learn the routine better. Also, when there are different steps to this whole routine, one step is a cue to the next step, especially when kids have difficulty learning from imitation. Just the fact, things like, flushing the toilet, that might be a cue for them to wash their hands. So one step is a cue to the next. So this is just an example that I have here of a routine, a visual schedule. And this visual schedule should be somewhere where the child can easily see it. Could be across the toilet, right next to the toilet. It should be somewhere where the parent or the caregiver can either draw their attention to that or the child can look at it easily. Any questions so far? Okay. Now I'm going to talk about motivating a child. Now I'm going to talk a little bit about positive reinforcement. We use both positive and negative reinforcement, and this is a really powerful tool to increase their motivation, especially for children who are not motivated at all to sit on the toilet, or rather are motivated to stay away from the toilet. So how do we bring them to do something that they really don't like? Now, positive reinforcement is giving something that's giving them something that they like to increase the likelihood of it happening again. So rewards. Now rewards are, parents will be like, a lot of parents say, I don't want to bribe my child. Positive reinforcement or rewards are very different from bribes. Positive reinforcement or rewards are given after they engage in the desired behavior. So giving a child an M&M because they sat on the toilet is positive reinforcement. But a bribe is something you do before they engage in the desired behavior. So giving them an M&M and saying, now I'm giving you an M&M, sit on the toilet. That's not going to happen. They're going to eat the M&M and not care about sitting in the toilet. So you need to wait for them to sit or to engage in the desired behavior. And that is more effective. Also, rewards should be absolutely immediate. We usually say try to do it within 30 seconds. Ideally, you would do it when they're almost getting out off the toilet, not even standing up, but as soon as they void, or you want to give them the reward immediately. Those are the most effective, so that they are able to quickly pair either sitting or the appropriate behavior with the reward. If there is a huge delay between the reward and the behavior, then they're not going to make the connection. It's going to be really hard to make the connection. If you say, oh, great job sitting, let's get a smoothie after dad comes home from work. So that is extremely delayed. It's like saying, I'm going to give you a paycheck once a year. 6 months into your job, you're going to be like, why am I here? So it has to be absolutely immediate. Working for immediate rewards are also easier. For me, a bag of chips now is better than maybe 1 month later being in better health. So yeah. Also, you want to offer the reward before they engage in problem behaviors. So if you say, sit on the toilet, and the child says no and has a tantrum, we say, okay, you can have a reward. You can have candy if you sit on the toilet. What we shaped or rewarded maybe is having a tantrum and then getting candy. So what we want to do is offer it before they even act out. Say, if you sit on the toilet, then you're going to get a piece of candy. Now, rewards have to really be something that they like. You definitely want to give them the good stuff, because this is something that they really don't like. Especially for some of our children who have very restricted interests or have very unique interests. It doesn't always have to be edibles. It could be a specific video, it could be access to the iPad for a specific duration, it could be a specific clip of a video. So you definitely want to give them what they really like and will work for. If they have some of our kids have very restricted interests, and if all he does is watches Thomas the Trains, then we might have to restrict it for toilet training. We might say, okay, you're going to be able to watch fewer minutes of Thomas the Train freely, but you can earn it for using the toilet. Because if they're getting it freely anyways, they're not going to be motivated to work for it. And of course, you also want to definitely pair it with praise. So therefore, when good things happen. When I use the toilet, great thing happens. It's a party. Mom and dad get excited. So they learn that behavior really quickly. You also don't have to give a huge amount. Like sometimes I'll say, just give them, one M&M, half a fruit snack, whatever works. But because you'll have to use it so frequently, you definitely want to restrict it, so that because you'll have to do it a lot more. And just like positive reinforcement, we also use negative reinforcement. Now, this is often confused with punishment, but really it is a reinforcement procedure because it is increasing the likelihood of a behavior. So what negative reinforcement really is you are doing something, you are rewarding a behavior that gets them out of an unpleasant situation. For instance, if my teenager is listening to really loud music that I don't like, and I say, Johnny, please turn it off, and nothing happens, but I yell and say, Johnny, turn the music off, and the music gets turned off, then I just got rewarded because the unpleasant music went away. So the same way, if the child getting out of the toilet is also a reward for the child. So if we're doing scheduled sits, and they, the moment they urinate or the moment they void, you want to remove them from the toilet because it is an immediate reward. Just getting off the toilet is an immediate reward. Now, part of the intensive toilet training, we do scheduled sits. This is a very successful component. This is a component of very successful programs. And basically what we're doing here is having the kids sit on the toilet during planned intervals. So usually we would start maybe at 30 minutes, every 30 minutes. We're going to do scheduled sits. So you're going to use a timer to prompt you. When the timer rings, you would give them a very brief reminder. It's time to go to the bathroom. You walk them to the bathroom, make them sit on the toilet, and set the timer. After the timer rings, they can get off. But you would do this every 30 minutes. And what happens is when you keep doing this initially, you will accidentally get a void. And the moment they urinate or have a bowel movement in the toilet, then you shower them with praise. It's going to be a party. So this increases the likelihood of them to void. This is, 30 minutes is not hard and fast. It depends on where the child is. If they're able to stay dry if they're usually dry during longer intervals, then we would maybe start at 60 minutes. Now, when you're doing the sitting, usually we would give them the reward after sitting. But while they're sitting, we don't want it to be too much fun because we want them to be motivated to use the toilet, to void in the toilet and get off. But it shouldn't be too aversive either. So you want to use like moderately preferred rewards. If they're too excited, if you have the best thing that they like on the toilet, like if you have the best video that they want, they might not be motivated to get it, but also sometimes they might be too excited and they might not be relaxed. So we want them to be a little bit relaxed, to increase their likelihood of voiding. So initially we're going to start with sitting, and according to a schedule. And the goal is not necessarily initially for them to void, but just to sit on a schedule. And so we also, this is a hard time because we don't know how long it's going to take. So we'll just have to be persistent and repetitive. Every hour or every half hour, we're doing these scheduled sits. We don't know when we're going to get a void, because initially it's just accidental. So we don't know if it's going to be in the first 5 minutes of toilet training, or the first 5 hours, or the first 5 days. We don't know. So it's important at this point for you to be consistent and persistent with the same schedule. If the child, we want to also make the bathroom a comforting area, not super fun, but comforting. So if there are things that they're sensitive to, if flushing is something that they're really afraid of, it is not a fear we want to work on now. We don't want to work on flushing. Or if there are noises, if there's too many distractions, we want to reduce some of that. We want to make sure that they're well balanced, so we need to get a footstool. And also, this is when you're going to pair the trips with communication. So when your timer rings, you sign, or you say it's time to go to the bathroom, and then when they're about to sit on the toilet again, you want to sign again, so that they make that pair, the connection between the sign and the toilet. If there are accidents, we want to reset the timer. So if we are doing sits every hour, and 15 minutes before their scheduled sit, they have an accident, we want to start the timer all over again to the next hour. This is just an example of a planned sit chart. So if you look at it, so initially as the focus is sitting, once they're able to sit consistently and they're able to have a few consistent voids, then we will increase our requirements. So then they would get their rewards only for voiding. And then if we get some bowel movements in there, we want to have a better reward there. So in this example, just for sitting for 3 minutes, they get a sticker. For urinating in the toilet, there's 1 fruit snack, but having a bowel movement is 2. So the difference is we want there to be a difference between just urine or bowel movement, and things like that. But this is very, very individualized. It really depends on the child, where they are, and what are their reinforcers. While we're doing intensive toilet training, we definitely want to load them with fluids, preferred fluids, and very frequently. This increases their likelihood of voiding in the toilet, also increases the likelihood of rewards. So more rewards, more voids, they get paired, and they're more likely to void. It also increases the likelihood of accidents, which I know is not fun, but we do need them. And I'll talk a little bit about why we need accidents and what we do with them. Any questions so far? Comments? Yes?
I have a question as far as the duration that you were talking about for them to be fully potty trained. It's like 2.5 years. So
of training.
Yeah, of training.
Yeah.
2.5 years. Now I know that a lot of people say that boys are harder than girls to potty train.
Yeah.
Would that be a longer duration for a boy that's on the spectrum?
Probably, yes. Yes, boys are definitely longer. Among typically developing children, I know that boys take about 2 or 3 months longer, could take up to 2 or 3 months longer on average. So even with kids with autism, it would take a little bit longer.
So would you be able to give a number?
It would be hard to say, just because kids with autism can be so different in terms of their functioning and their abilities and their development. So it would really be, and because I don't know very much, so it would be hard for me to give you an estimate.
So is that duration based on the actual diagnosis?
It would be based a lot on the intensity of toilet training, on just a lot of factors. Intensity of toilet training, their ability, just many other factors, their reinforcers, their interest in things. It would be really hard. And that's why I do want to say that what I'm talking about are very general strategies, and they can't be, toilet training can be extremely individualized depending on the child. So these are strategies that we use generally. However, if it is more complicated, if a child is taking longer, or it's harder to toilet train, then we would say, you would have to come into our clinic, or get some professional services to see what's going on, because when there's a problem, we'd really go into detail as to where did we start, what did we try earlier, what didn't work, like was it behavior problems that were interfering, was it the ability, was it the kind of reinforcers. So it would have to be, so it would be hard for me to give you a very individualized response. Yes.
If your child is still napping an hour or two, do you put them in a diaper during that time period if you're doing the...
During the naps?
Yeah.
Yes. You could do diapers during naps, yes. Okay, once we start toilet training, a lot of people say, take baseline data, take 2 weeks data. We don't really require you to do that. We want you to start immediately. But once we start toilet training, we definitely emphasize taking some data on toilet training. So we would start by saying, having some information on whether it was success or not. So success or accident, and whether it was urine or bowel movements, what time, dates, what is the duration between sits. Are we doing 30 minutes, 60 minutes, 45 minutes? We also definitely want to include there what is the activity that they were engaging in. Were they watching TV? Were they playing on the iPad? Were they just doing Play-Doh? And that would also kind of give us some indication of progress. So we need, because usually we feel like we have a good sense of data, but really when we take real-time data, we realize our memories are very fallible, and it might look very different from what we were thinking. Sometimes there might be patterns of eliminating that we might find from data. So maybe the child is having accidents right after nap time, or maybe they're having accidents when they're watching, when they're on the iPad playing this most preferred video game, or it's when it's time when the whole family is at home, all the siblings are back from school, parents are back from work, and we're maybe not doing the scheduled sits as we should. So it definitely helps us understand some patterns there. Data also helps us do elimination likely sits. So there are times that elimination is likely, and this is true mostly for bowel movements. So maybe there are times that they're likely to have a bowel movement. Usually it's after meals, or after after they wake up. So that might also be helpful. And data collection also helps us gradually increase the duration between our sits. And we'll talk a little bit more about how and why that's important. Now, what do we do when we have accidents? We've talked about when they avoid successfully, you give them rewards. What do we do when we have accidents? And what we do is use a punishment procedure. And the punishment procedure that we use is positive practice over correction. So punishment is basically, the idea is to decrease the likelihood of a certain behavior. So you give them a mildly aversive consequence to the behavior you don't want, so that it decreases. Positive practice is really practicing what is the appropriate alternative. So instead of having an accident, I should have walked to the toilet, sat on the toilet, gotten off the toilet, pulled my pants up. So that is the alternative, and that's what we're going to practice. Now, overcorrection is over-teaching it. So it's not just doing that once, but it's doing it multiple times. It's like if I'm learning to play this piece on the piano and I keep messing up, I don't just practice the correct way once, but I practice it multiple times to get a better mastery over it. And so this procedure really involves about 3 times what you would do in positive practice is when there is an accident, even with a wet stop, and I'll talk a little bit about it, you give a very brief reminder. It could be anything, such as no wet pants. Then you would guide the child to the bathroom, guide the child. When I say guide, I would put my hands on their hands and make them pull their pants down, make them sit on the toilet, get them off the toilet. They have to sit on the toilet just for a couple seconds. You're not going to make them sit for a few minutes. Make them get off the toilet, stand up, pull up their pants, and bring them back to the area where the accident occurred. And you will do this 3 times. And when you come back, of course, you give them the same reminder saying no wet pants. So this is a negative consequence, but it is also kind of feedback to the child that this is the appropriate behavior, and that the accident is not appropriate behavior. So that is the whole purpose of it. If when you make them sit on the toilet, and you get off, you don't give them a reward. Sometimes if you when you're putting them on the toilet and you're about to get them off, if they're beginning to urinate or have a bowel movement, you will let them void, but you will bring them back quickly, and you will not reward it at that time. Because this is a consequence at this point. It is also important to do this in a very neutral tone, because it is not an expression of our anger. It's really just a consequence for them to learn what is appropriate behavior. It is not about, I know it is very frustrating to be doing this, but we want them to not see our frustration. Yes?
Just a question for you. Do you tell them then they're not going to get a reward?
No, so because you want to really minimize any talking, any reaction. So you go into this mode where this is what you do. I say it's do the robot mom mode, because we don't want any reaction. That's what you do. You say no wet pants. We don't want you to make eye contact. We don't want any emotional reaction there. So there's a stark difference between successes, which is voids in the toilet, and so that's when mom gets excited, dad gets excited, things are great. But when there's an accident, then this is what happens. It's not for it to be it has to be boring. That's why I say it has to be neutral. It's not like it should be painful, but it's boring, and it's so boring that the child will work to avoid it. So when you pair it with rewards, then it's more effective.
At what point do you change their clothes?
At what point?
Once they have an accident.
You could do it after you do positive practice. Yeah, because you want that to be really immediate too, so that the feedback is very immediate, so that they make that connection really quickly. Because if we first change, because there might be a delay then.
So you have a pair of pants in the bathroom. Is that change your pants in the bathroom and just change it right there?
Sure, yes, but the three times that you do positive practice, you will bring them back to the area where the accident occurred, and after that you can change them. Yes.
Do you have them participate in the cleanup process? Like, say if they because I think it's kind of like a moment back, but if they were doing a whack as you were pulling them down, pulling their pants down, getting ready, and some got on the floor, would you have them participate in the cleanup process to understand that as well as something they shouldn't do?
Not necessarily. Now, what you're talking about is we call restitution overcorrection. It's another procedure where you're trying to restore the environment. So that's when, that is another good strategy. We don't really use that, but strategy that you would have them clean up the area. But we want it to be kind of a routine, in that the accident happens, this is what happens, and this is not fun, so they will learn it. The child does not necessarily have to clean it, because we want it to be very clear for them to learn it quickly, if that makes sense. Yes?
Is there an age group that relates to all of what you're saying? Because I have a child that's 6.
Yeah.
I do believe he has passed what you're saying.
Yes. So it's if they're 6, it really depends. If they're around 6 is you might or might not be able to do it, because if you're able to, sometimes they might be problem behaviors, and sometimes we'll say you would still go through their problem behaviors. If I'll say I'll get hit by a 6-year-old, I'll still keep doing it. But if they're bigger and you're going to get seriously hurt, if you really can't physically guide them, yes, like by 6, 7, 8, somewhere around there, it's hard to give an age, but around then you would stop using this and you would use another punishment procedure and punishment procedure doesn't have to be positive practice over correction. It could be removal. If they're older, more advanced, it could be removal of privileges. Now they lose screen time or they lose Xbox and things like that. But yes, but just because little kids, if they're having behavior problems, I would still, plow through and say, just keep doing that, because we don't want them to escape that or get out of it because they're hitting. But yes, if they're bigger and harder to, if you're not able to physically do it, then it might not be a procedure we would recommend. Yeah. But then there are older kids who you could, physically guide in that 8 or 9 years. You could do it and they wouldn't fight you. So it really depends. Now, positive practice over correction has been associated with very rapid learning of toilet training in many, many studies. There is a bit, because now there is a huge influence of positive behavior support. We want more positive. There is an emphasis on positive interventions and not very many, and rather a de-emphasis on punishment procedures. More studies are trying to get trying to not use punishment. However, we're finding that punishment really is more effective, especially to learn rapidly, to self-initiate, and we'll talk a little bit more. And I was looking at some alternatives to toilet training, alternatives to using punishment, but what they're doing is they're having the child sit for really long periods and then getting them off when they have a successful void. So what the idea behind that is a negative reinforcement procedure. So we're saying, so the studies are saying we're doing negative reinforcement, we're not doing punishment, but what they're doing is negative reinforcement is when you're trying to, you get them out of an unpleasant situation. But to get them out of an unpleasant situation, you kind of have to put them in an unpleasant situation. So there are studies where they have the child sit for 30 minutes on the toilet, and when there's a successful void, then they have them get off for 5 minutes, but then they go back to sitting on the toilet. So they do this toilet training for hours, which I think could be a very punishing experience, although it's not technically punishment, it's negative reinforcement. So we're definitely seeing some resistance to punishment. However, it is a very effective technique. To go along with what we're doing in terms of sits, we also use what we call a wet stop. It is a little device that has a moisture sensor and an alarm. So the moment a child is beginning to void or urinate, when it detects the first few drops of urine, there is an alarm that goes off. And this is a very effective technique if the child is willing to use it. So because a parent can give a very, very immediate consequence. The moment the alarm rings, then you would use positive practice. However, although it's extremely effective, it's a really great way to learn, children don't love it. So if the child is extremely resistant, we might not be able to use it. My boss always says this, and it's kind of a terrible example, but it's like, telling a fugitive to carry your GPS with you, because you can track them down. The moment there's an accident, they get positive practice. If you're not using a wet stop, and also if they are resistant to it, sometimes you could try using a fanny pack, having them wear it on the back so they're not able to access it and unzip it and take it off, because they will try and pull it off because you attach it to them. Sometimes I've heard of parents sewing it into their pockets, or also you might wear, if they have pants, you can put it in the pocket and make them wear the pants with the button at the back so they can't get access to it. So those are some creative ways of wearing a wet stop. But if they absolutely will not wear a wet stop and they're extremely resistant, there's also, because of the alarm that can be startling, although there is a controller to decrease the volume of it. If you can't use a wet stop, then I would say do dry pants checks. So every 10-15 minutes, you go and check their underwear. If it's dry, you get excited. There's a lot of praise. So there's, again, the constant feedback. and you could have them, usually we say, wear some light colored sweatpants, so the moment there's an accident you can easily see it. If it's dark colored, it might not be, you might not, so that your consequence is immediate. Questions? Okay, I'll keep going. Wait, did I skip one? Okay. Now, self-initiation. Once they're able to consistently void in the toilet based on your schedule, you want them to self-initiate. You don't want them to always be prompted. You don't want them to wait for either prompt by the timer or prompted by you. You want them to be a little bit more independent in that. So this is the stage where they're able to discriminate natural cues. They're able to tell that they're able to read cues such as the sensation of the bladder being full, or pressure on the bowel, and they're not depending on you to guide them to use the toilet. And this is definitely harder to acquire, and this is why positive practice is so important, because positive practice makes them take that extra step to be mindful of their own cues, of the more natural cues, and rather being dependent on your timer. And initially you want any kind of self-initiation. So if you find that the child, there might be signs that indicate the child might void. If they're pulling at their crotch, you want to quickly catch that and pair it with communication, and then take them to the bathroom so that they learn to discriminate some of these cues. And so because of self-initiation, what we want to do is increase the duration between sits. So when you increase the duration between sits, you might have more accidents, and they will work hard to avoid positive practice, because you'll have accidents and you'll do positive practice, and the kids will really not want this, and that's why they'll work hard. A guideline that we use, because we don't want to jump ahead before the child is ready, we use a guideline of when the child is successful for 2 days, for about 70 to 75% of the time, then we increase the duration of sits by 15 minutes. So if we start at 30 minutes, for 2 days they're consistently able to void for about 70 to 75%, then we will increase it to 45 minutes. And the way you calculate void is basically divide the number of successful voids that's in the toilet by accidents and successes, and that's how you get your percentage. Sometimes, caregivers don't want to start this because you're like, he's going to the toilet, I use a timer and he's going and things are great, there's no accidents, but we want to keep you moving along, because we don't want you to be stuck in that phase. We want them to be a little bit more independent, we want them to initiate, so we definitely want to keep increasing the duration of sits if they're being successful. Unfortunately, we do want some accidents. So that would really help them self-initiate. Once they're self-initiating, then we want to generalize. Because we usually like to start at one bathroom in the house, or just one area, we want to increase it to maybe showing them and then rewarding them for using other bathrooms in the house. And then we generalize this to using the bathroom in a public place. So we definitely want to plan how they would transfer their skills to a different setting. And this is pretty much the last stage, which is independence. And during this stage, they don't need you at all. They don't need you to tell them when you need to go to the bathroom. They don't need you to also help them with the pre and post voiding skills. So things like pulling down their pants, pulling up their pants, flushing the toilet. They are able to do all of this by themselves. So we want to make sure we are fading our prompts. If we have gotten into routine and say, we're like constantly prompting them, say, pull down your pants, sit on the toilet, get off the toilet, pull your pants down, pull your pants up. Sorry. We want to gradually decrease those instructions because we want them to be a little bit more independent. We don't want to decrease it completely, but we gradually want to decrease it. So we gradually fade out our instructions. We gradually fade our rewards. so that they're able to come under the influence of just natural, reinforcers. So ultimately, to maintain it, when you're acquiring a skill, you want to get very frequent, immediate, quick rewards, quick consequence. But ultimately, we want them to be functioning in a real world where it's just natural consequences, which is maintaining the skill. So just being dry by itself is a reward. So that's why we want to gradually decrease that. Okay, yes.
Any suggestions for schools, because they like to put it on their goals,
Yes.
and they might have started before the parent really started this intensive work.
Sorry, can you?
They may have started it, but
Yeah.
the parents have started really thinking about doing this
Yeah,
intensive.
yeah. It's good to have like a consistent kind of routine if they're able to coordinate that. I don't know if that's helpful.
I think that's important, yes.
Yeah, absolutely. If